Hi, happy morning, everyone. Welcome to Metier YouTube channel. I hope you are all fine and doing well for your exams. Okay, we'll start today's 5 important MCQ for the exam of AIIMS and JIPMER. And kindly please subscribe our channel. Please support us so that we can upload more questions. As I said last class also. So try to share to your friends who are doing nursing. Okay. And in Metier, we have started a fourth year program also. So who are studying in the fourth year BSc nursing, they can also join for the classes so that they can crack the exam as early as when they complete their course. Okay, we'll start today's session with a small quote. Don't wish for it, work for it. Okay. அது ஆசைப்படுறது மட்டும் இல்லாம அதுக்குண்டான வேலைகளும் பண்ணாதான் நம்ம சக்சஸ் பண்ண முடியும். So don't wish for it, always work for it. We'll start today's session. Today we are going to see about very important topic, that is antidotes. Okay. So most of the antidotes you all know. We'll see one by one. First question, a 76-year-old male is admitted to the ER. The patient accidentally overdosed on atenolol. The patient heart rate is 38 beats per minute and blood pressure is 52 mm of Hg. The patient is lethargic, sweaty and vomiting. What is the antidote for this medication? Options, Digibind, calcium gluconate, glucagon, calcium disodium acetate. So the correct option is glucagon. So the glucagon is consists of first line antidote for the beta blockers. So here the scenario they're telling about atenolol. Atenolol is a beta blocker. So the beta blocker antidote is glucagon. That is the basic things. What else is happening here? Because of atenolol heart toxicity, the patient heart rate is 38 and the blood pressure also hypotension. So what this glucagon will do, it cases the cardiotoxicity. It reverses the cardiotoxicity by stimulating the cyclic adenosine monophosphate. So thereby it improves the heart rate. Clear? So here the correct option is glucagon. So don't think that I'm not explaining other options. That other options we will see it in the each next slides also. Okay. So next slide is physostigmine is an antidote that can be used to treat what condition below. The correct options are, the options are cyanide poisoning, cholinergic toxicity, iron toxicity, anticholinergic toxicity. So the correct option is option D, anticholinergic toxicity. So physostigmine is an antidote for anticholinergic toxicity. Okay. Otherwise, it's called physostigmine salicylate. It's the only reversible acetylcholinesterase inhibitor. So here the option is they have an anticholinergic drugs. What are the anticholinergic drugs? So, for example, atropine toxicity, glycopyrrolate toxicity, benztropine toxicity, all this comes under anticholinergic toxicity. So, when there is an anticholinergic toxicity, the only drugs can be used as an physostigmine. Clear? Yes. Next, hydroxycobalamin is an antidote to treat what condition below? Iron toxicity, lead toxicity, cyanide poisoning, ethylene glycol poisoning. So the correct option is cyanide poisoning. Currently the available cyanide antidotes are hydroxycobalamin, sodium nitrate, and sodium thiosulfate. So in exams, they won't ask same three options and all. So you can correlate with the three best options are hydroxycobalamin, sodium nitrate, and sodium thiosulfate. If in case they have given these three options together, you can go with the hydroxycobalamin. Clear? For iron toxicity, option A, iron toxicity, what will give? Will give the chelating agent called deferoxamine. Okay. We'll see the cyanide poisoning and ethylene glycol poisoning in next slide. Yes. So the EMS calls into report that they are transporting a 22-year-old patient who attempted suicide by ingesting ethylene glycol. Prior to the patient arrival, what medication will you have readily available? So when the patient is having ethylene glycol, they're going to come to the emergency department. As a nurse, which medication we have to be kept ready? So the options they given: fomepizole, naloxone, deferoxamine, acetylcysteine. So the correct option is fomepizole. Is an alcohol dehydrogenase enzyme. Is an antagonist. Is the preferred therapy for when the patient is having ethylene glycol poisoning. So some toxicology studies are saying that we can give ethanol also. When there is an ethylene glycol poisoning, we can give the ethanol. But this American Academy of Clinical Toxicology, they have developed the fomepizole is an more safer than ethanol. So that is why the fomepizole is an antidote for ethylene glycol. Clear? So naloxone, you all know it's an opioid antidote. Deferoxamine, as I said, it's an iron chelating agent. Acetylcysteine for the paracetamol poisoning or acetaminophen poisoning. Okay? Okay. Next question. A child's lab results demonstrate lead toxicity. What is an antidote for this condition? Options: vitamin K, calcium disodium acetate, flumacenil, hydroxycobalamin. So the correct option is calcium disodium acetate. Actually speaking, there is no antidote for lead toxicity. So the calcium disodium acetate, otherwise called EDTA, okay? EDTA also. So what they are also chelating agents. What is meant by chelating agents? These chelating agents bind with this lead. For example, this calcium sodium disodium acetate, it will bind with the lead so that it can be excreted through the urine. So that is what it's happening. Chelating means it will bind with the excessive medicines or drugs so that it can eliminate it through the feces or a urine. Here, this lead can be eliminated through the urine with the help of calcium disodium acetate chelating agent. Clear? So vitamin K is an antidote for warfarin. Flumacenil for benzodiazepine, right? And hydroxycobalamin we have seen here. Yes, right. So thank you so much. I hope today's class was helpful for you. Please subscribe to our channel and please read for the exams very carefully because we have very less day only. Okay. Thank you so much. Take care.